Okay. I stay on 2 this whole time for this toss, right? I stay on 2 the whole time for the toss? Okay. So when I toss to the presser, I turn to 3. Okay. Oh, there is a fly in here. That's going to be fun. Good afternoon. We are breaking into regularly scheduled programming for a COVID-19 special report. I'm Rachel Yankunas in the Fox 43 studio. We are expecting to hear from acting Pennsylvania Department of Health Secretary Alison Beam and acting Physician General Dr. Denise Johnson about the virus in the Commonwealth and efforts to get more people fully vaccinated. Secretary Beam is at the podium now. Let's listen in.
Your friends, your colleagues, and everyone else with whom you come in contact. To all Pennsylvanians who have already been vaccinated, thank you. If you have not been vaccinated yet, now is the time to get vaccinated. And if you have only received 1 dose of the vaccine, it's never too late to get that second dose. This is very important because you need to be fully vaccinated to have maximum protection against the Delta variant, which is spreading across the country. In fact, starting next week, the Department of Health is launching a second dose reminder text messaging initiative. We will be reaching out to individuals who, for whatever reason, got their first dose but missed their second. We want to remind everyone that getting that second dose is important to help protect against the Delta variant. While the recommendation is to get the second dose within 42 days for best results, it is never too late to get your second dose. You do not have to start over. If you moved here from another state, we advise you to locate a provider nearby to get your second dose. And even if you're one of the first people to get vaccinated back in December, if you missed your second dose, there is still time. Get it now. There is no excuse, and there is no time to lose. Text messages will be sent early next week to 254,850 people. The first text message will go to people who got their first dose between December 14th, 2020 and May 14th, 2021 and have not gotten their second dose, and you will receive 1 text message reminder. The message will be very short and very to the point. Quote, "Hi from the Department of Health. Delta variant is here. Get your second dose of COVID vaccine to be protected. It's not too late, and to find appointments, vaccines.gov." End quote. We know that barriers to getting the vaccine exist, and Dr. Johnson will talk about that in a few minutes. But remember, you don't need to get your second dose at the same location where you got your first dose. COVID-19 vaccines are now readily available at hundreds of local pharmacies, CVS, Walgreens, Rite Aid, Walmart, grocery stores, doctors' offices, and hospitals. And I'm proud to say that folks continue to step up and to do their part to end this virus. Yesterday, 20,478 doses of vaccine were administered across the state. We are averaging more than 12,500 vaccinations every day in Pennsylvania. That is impressive, but we need to do more. If you aren't yet fully vaccinated, I urge you to visit vaccines.gov to search for locations that offer the COVID-19 vaccine near you. Or text your zip code to GetVax, that's 438-829 for English, or Vacuna, that's 822-862 for Spanish, and receive 3 possible vaccination sites in your area with types of vaccine available and phone numbers to call for an appointment. We are committed to fighting this virus and will continue working to ensure every Pennsylvanian has access to getting the vaccine. Now, it's my pleasure to introduce Dr. Johnson, the Acting Physician General for the Commonwealth.
Well, thank you very much, Secretary Beam. Good afternoon. And I'd like to start by just echoing what Secretary Beam has said. To those of you who have already been vaccinated, thank you. Now you have the best protection against COVID-19, best protection against severe illness, hospitalizations, and you also have the best protection against spreading to others. As we've seen over this past 16 months, people can have severe, life-threatening illnesses with COVID-19. And you don't always know what kind of effect you're going to get when you get COVID. And as I said before, you can spread it to your family and friends and all those who are around you. As I'm sure all of you have noticed, over the past couple of days, we've had an increase in our COVID cases. Just of yesterday, we had 1,088 new cases of COVID. We now have 445 people in the hospital. 46 of those are on ventilators, and we've recorded 7 deaths. The disappointing part of all of that is that these hospitalizations, cases, and deaths could have been prevented. We know that getting vaccinated significantly decreases your risk of getting sick with COVID and being hospitalized. When people are vaccinated, it increases the capacity of our healthcare systems to care for people who are ill with chronic diseases, but also acute conditions like stroke or heart attack. If you've not been vaccinated, or you've only received 1 dose of a 2-dose regimen, as Secretary Beam said, now is not too late to get vaccinated. For the J&J vaccine, you only need to have 1 dose to be fully protected. But for the Pfizer vaccine, you need to get that 2nd dose of Pfizer. And for the Moderna, you need to get that 2nd dose of Moderna to get the full protection. Especially as the Delta variant is circulating, as we know, 1 dose does not give you that full protection. You need to get both doses. So we urge you to get that other dose. It's also important to know that the Department of Health is making this and has made it a top priority to make sure that vaccinations are available to everyone in the Commonwealth who is eligible. And to do that, we've had to overcome barriers like transportation to vaccination sites, making sure that vaccination information is available in multiple different languages, and making sure that actual vaccines are available at lots of different types of providers. We also wanted to make sure that there's good information, and if you go to our website, pa.gov/COVID, you can get information about vaccinations. You could also get information on how to talk to other people about vaccinations, and you also can sign up for our newsletter so that you could get update on our vaccination process. We want you to have this information so that if you've not been vaccinated, you can make that decision, but also so you can share that information with your loved ones to help them to make that decision. We've also been working with local providers in communities to make sure that in communities that are under-vaccinated, they have the resources and the information to get more people vaccinated. We've also expanded our vaccination clinics, and so now they're available in primary care physician offices, in pediatrician offices, as well as hospitals, retail pharmacies. We're also going to unusual places like houses of worship, community centers. And as the summer has been moving on, we've also partnered with organizations to be able to provide them at county fairs. Most recently, we've partnered with ACH Clear Pathways in Pittsburgh, the Greater Hill District, and we vaccinated 2,000 people, where about 63% of the residents are African American. We've partnered with the Beacon Clinic for Health and Hope in Harrisburg, hosting 2 community events there, and made sure that uninsured people were able to receive the vaccine. It's very important for you to know that the vaccine is free of charge for everyone. So if you're insured or uninsured, it's still free for you. And even if you're asked for an insurance card, which may be routine, all you have to say is that I don't have one, and you should be able to get your vaccine free of charge. We want to make sure that everyone knows that. We're continuing to make sure that we provide good information. So you've seen our media campaign on billboards, you've seen them on TV, digital media as well. And as I mentioned before, we've got weekly updates, a weekly newsletter. As soon as the vaccine was available, I took it seriously and I got myself vaccinated. I also vaccinated many of my colleagues and hundreds of people in my community because I knew that was the best protection, not only for me and my loved ones, for my patients and for my co-workers, but for my entire community. I knew that I was protecting people who are not able to get vaccinated yet, like our children, but also people who are not able to get vaccinated at all, like those who have underlying conditions. And I knew that I was doing my part to help us get out of this pandemic. We have seen that vaccines are safe and effective, and they work, and they were decreasing our cases and decreasing our hospitalizations and deaths. So all of you who have not yet been vaccinated, I urge you to take that step. And those of you who have been vaccinated, I urge you to spread the word and let other people know why you were vaccinated and help us to protect, again, those vulnerable ones in our society. I thank you all, and I'll turn it over to Secretary Beam, and we'll be happy to take your questions.
Thank you, Secretary Beam and Dr. Johnson. Today we will be taking one question from each reporter in the order that they were RSVP'd to allow for as many reporters as possible to ask their questions. We will identify who is up next using the chat feature. Thank you for your cooperation and participation. First up, we have Travis Gary from WJAC. And Travis, make sure you unmute.
Can you hear me?
We can, yeah.
Oh, okay, sorry.
Ooh,
All right,
faintly.
so my question is just regarding the recent federal recommendations regarding mask wearing. We've had some viewers reach out to us with confusion on should they wear a mask or not, especially fully vaccinated people. Are you worried that kind of this mixed messaging is could that kind of muddy the messaging regarding the effectiveness of vaccines if fully vaccinated people still need to wear masks?
Travis, I was able to faintly hear you. I believe the question was oriented towards the CDC's updated masking guidance and whether or not that muddies the water, given that fully vaccinated people in certain communities are going to have to wear masks. With that being said, of course, we want everyone to be able to abide by the CDC guidance. And so if you are in a community that is at that high or substantial level of transmission, a mask is another public health tool to prevent that spread that even immunized individuals could potentially be spreading throughout their communities. So while it's another layer of protection, we know that wearing a mask is one tool, but it's also important to get vaccinated so that your community level of transmission can also decrease and hopefully contain that spread.
Next up, we have Jim Meltward from KYW News Radio.
Following that, the updated CDC guidance, what is Department of Health saying to schools, and is there guidance planned for K through 12?
So the Department of Education and the Department of Health have been lockstep throughout this summer, asking schools and really guiding schools to abide by the CDC guidance. So the CDC previously issued guidance for schools on all things with regard to whether or not you have a positive student or a teacher or the like. Likewise, we strongly urge schools to then abide by the emerging CDC guidance about masking in K through 12 as well.
Our next question comes from Jamie Martinez from Spotlight, PA.
Hi, Secretary Beam. Thanks for taking questions. Can you talk a little bit about what we know about counties where there is higher substantial spread? What's driving that spread? And is there any correlation with vaccine rates? Basically, what do we know about what's going on there? Thanks.
Sure. So right now, Pennsylvania has 7 counties that are in that high and substantial range. And yes, there is a correlation with low vaccine rates. But really, we also understand that it's in these communities where the transmission of the disease is happening, likely because folks aren't as vaccinated, and that's where you're going to find that it's the high test positivity and also high case count that really generate that CDC higher substantial risk county.
Our next question comes from Mark Hiller from WBRE and WYOU.
Hello, Secretary Beam. Thanks for taking my question. And it would be, what do you say to someone who is still vaccine hesitant? They want to see an extended period of time from effectiveness, since the FDA did not actually give approval, but just emergency use authorization, and even concerns about infertility down the road.
Yeah, so first and foremost, we've been guiding folks to their clinicians. 96% of physicians have gotten vaccinated, and we have always advised that folks speak with their clinician to really have that informed conversation specific to them. But taking my own advice here, I'm actually going to turn it over to Dr. Johnson to speak from a clinical perspective on the fertility concerns and the like.
Thank you, Secretary Beam. Yes, certainly want to echo that. If someone has questions, certainly speak with your clinician. And I know that your clinician is going to recommend vaccination. We know that we are having a resurgence now of COVID because we have a reservoir of people who are not vaccinated. And so the virus is free to spread in that group of unvaccinated people. That's why we're seeing more cases. So the more people that we get vaccinated, the less likely we're going to have continued spread, but also the emergence of other variants that are possible. In terms of the fertility questions, I would say certainly speak with your OBGYN, because the OBGYNs, as well as all of our societies, recommend vaccination. We know that COVID can be pretty severe for pregnant women, and pregnant women have worse outcomes with COVID, and especially worse fertility outcomes, more pregnancy loss and stillbirth as well with COVID. We know that we've had thousands and thousands and probably millions of women who have had the vaccine in pregnancy, and they are not they are not experiencing any worse outcomes. And so we know that the vaccines are safe, we know they're effective, and we know that the physicians recommend it. So as Secretary Beam has said, recommend that person speak with their healthcare provider.
Next, we have Taylor Toshef, ABC 27.
Hi, thanks for taking my question. So since the department is going to be sending out text messages next month, you guys must know the number of Pennsylvanians who have missed their second dose. So what is that number? Because looking at the percents of fully vaccinated and the percents of receiving at least one dose, there is a big gap in between that.
Sure. So what we're looking at to make sure that our text messages are also being received by the right people are really those that have almost had what would be a month and a half now, or 2 months and 2.5 months now from their first doses, so that they're able to really be individuals that didn't just go beyond the 42 days, that at this point, we just want to make sure that they actually know how critical that second dose is. The number of text messages going out is right above that 250,000, and that's close to about how many folks we know actually haven't secured their second doses. And so we're reaching everyone that we can, really those that have not only not received their second dose, but they've shared their contact information so that we can really follow through with them and make sure that they know that they can go to any of those possible locations, the hospitals, the independent pharmacists, any of those pharmacy chains, and follow through with getting fully vaccinated.
Our next question comes from Boris from the Scranton Times-Tribune.
Secretary, I missed the first part of your presentation early on. I just wanted to be clear on whether or not the department is doing anything specifically differently to get more people vaccinated. Obviously, you want to get the second dosage. You just spoke about that. But in terms of reaching out to people who haven't been vaccinated, are you doing anything differently?
Sure. So today's announcement is an exciting one because this is our text campaign to push folks to make sure that they get their second doses so they're fully vaccinated. But Dr. Johnson has really been able to spearhead a lot of our hesitancy, and she can speak better to a lot of the work that we're doing to get folks vaccinated.
Great, thank you. So in addition to sending out the reminders, the text reminders for the second dose, we have expanded our provider network. So we really have been reaching out to primary care providers as well as pediatrician offices to offer vaccine there. We've also made sure that providers are aware of the fact that we want everyone to get vaccinated, so that if there is a person to be vaccinated, even if there's a possibility of wastage of a few doses, we want to make sure people get vaccinated. We also, as before, have reached out to retail pharmacies, and they are helping in the effort. Vaccinations are available at many different pharmacies, but we also have, as I mentioned before, partnered with the county fairs. There are a lot of county fairs that are occurring this year, so we're making sure that there's vaccine available for people as they attend those events. We've also partnered with a lot of different groups so that they have outreaches that are happening at community events that are not fairs, in their local houses of worship, in community centers. So we're continuing those efforts as well, and then trying to get as much information out as we can in our media campaign, but also we are using a lot of local grassroots organization to be able to educate those people within communities as well.
Our next question comes from David Wenner from Penn Live.
Thank you. I'd like to find out what your best estimate is regarding the prevalence of the Delta variant in Pennsylvania right now. And I ask that from the point of view that I know the state relies heavily on the CDC, but as we know, there's a big lag there's a pretty significant lag with the CDC, and there's at least some labs in the state that can test for it, and they seem to be getting much higher percentages than we're hearing from the CDC. But I mean, what do you know about it?
Sure. So
regarding Delta.
Yeah, so thanks, David. So speaking from a national level, the CDC is using the estimate of roughly 83% of our COVID-19 cases right now in this country are actually Delta variant cases. What we've been able to determine from a state, and as you actually point out, our lab sequencing capability, we are working tirelessly to build up and make sure that we are getting as many cases as possible to the right labs to get genomically sequenced. But ultimately, some of the best data that we have to go off of is a regional number. And regionally, we're roughly at 65% of the cases in the state conglomerate that makes up Region 3 of HHS are right now determined to be the Delta variant. And so that is a pretty accurate understanding of the Delta variant present in Pennsylvania.
Next, we turn to Lindsay Weber from Capital Star.
Hi, thank you for taking questions. I'm wondering if you could speak to a little bit about breakthrough cases in Pennsylvania and of the prevalence of people who might be vaccinated but still test positive for COVID-19 and what that kind of means about the efficacy of the vaccines.
Sure. So we know, again, working closely with the CDC, we know that breakthrough cases have happened in Pennsylvania, and we're working, again, our team is working diligently to do the right data matching so that we can identify breakthrough cases and understand the quantification of them in Pennsylvania. Importantly, though, what we really know is that in that population of those that are hospitalized right now, or tragically those that have passed from COVID, they are a majority, a significant majority of them are the unvaccinated population. And so 97% of individuals that actually are hospitalized for COVID are unvaccinated. 99% of our COVID-19 deaths right now are those that are unvaccinated. And so while we will closely monitor the breakthrough cases to understand what we can do, the greatest protection folks have against getting ill from COVID-19, being hospitalized or death, is really getting vaccinated. And that's where we're focusing a tremendous amount of effort right now.
Our next question comes from Tom Lehman from WGAL.
Secretary, thanks for taking some time to answer our questions. A lot of our viewers are interested in vaccine mandates based on what we're anticipating coming from the Biden administration. Can you give us any information on whether the state at any point plans to implement any kind of measure for state employees or teachers, and if so, why or why not?
Sure. So right now, by way of vaccine mandates, we know that there are a lot of clinical trade organizations that came out just earlier this week and encouraged their own memberships, so their own hospitals, their own skilled nursing facilities and the like, to require vaccines within their healthcare workforce. And we obviously support that in that our healthcare folks are truly our heroes that have been our front lines throughout this entire response. And so keeping them safe is a priority going into this fall, a very high priority. And so we are also looking at other states, and we're watching closely what they're doing by way of vaccine mandates. But right now we are simply encouraging those that have had their workforces vaccinated, and we want to make sure that we can stand by them in those efforts.
Our next question comes from Justine McDaniel from the Philadelphia Inquirer.
Hi, Secretary Beam. Thanks so much for taking our questions. Yesterday, New Jersey implemented a statewide masking recommendation for folks who are indoors. And, the CDC guidance can be confusing for residents because you have to look up your individual county, and counties are moving in and out of different categories. I'm wondering if you think it might be less confusing at some point to implement a statewide recommendation, and at what level of, cases you might consider doing that.
Sure. So let me be clear. A statewide masking mandate is not currently under contemplation for Pennsylvania. We are closely looking at what the CDC really delivered by way of guidance for indoor mask wearing. But at this time, we want to make sure that folks are really focused on getting vaccinated. That is a new tool that we have that we're going to be able to be responding to COVID-19. And so while we continue to explore the use of masking, that's a tool in the toolbox, and we want to make sure to focus on the vaccination effort right now to protect us heading into the fall.
Our next question comes from Scott Beveridge from the Observer Reporter.
I don't have a question. Thank you.
Okay. After that, we have Leif Grice from the Allentown Morning Call.
Yeah. Hi. As you may have noticed, there's been certain amounts of substantial spread in the Lehigh Valley, Northampton County particularly, but also cases are still rising in Lehigh County. Both Lehigh and Northampton counties have some of the highest vaccination rates in the state. So can you explain why we're seeing such a high increase while there's other places that are much less well vaccinated that aren't seeing the same kind of increase?
Sure. So there's a few contributing factors. And first, while we are extremely proud of Pennsylvania's vaccination rate, we know that we still have only 52% of our population fully vaccinated, of the entire population. And so what we want to make sure of is that, as Dr. Johnson had referenced earlier, we really get as many folks vaccinated as possible so we minimize the areas where that COVID spread can even take place and where COVID can find a home in an individual. Likewise, we know that where there are communities that are naturally just more populated and more closely together, given the nature of this respiratory virus, the contagiousness, particularly of the Delta variant, is something that is a threat to us protecting our communities. So while we will, of course, continue to push vaccinations and make sure that that's a tool to keep folks safe, we don't want others to forget that, again, just keeping ourselves, if necessary, masking where folks feel safe, or also social distancing or other tools that we can do to contain the spread of COVID in the community.
Next up is Boyce Buchanan from the Pittsburgh Post-Gazette.
Hi, thank you so much for taking our questions. As more variants are popping up and there have been some breakthrough cases, what are your thoughts on the booster shot and potential recommendations for that?
Absolutely. So as the Department of Health is focused on emergency preparedness, we know it's our duty to come to any vaccine campaign, likely what will next be even further adolescent vaccine campaigns or a booster shot campaign, fully prepared. So right now we are doing a lot of scenario planning and strategic thinking about how we're going to be able to get as many Pennsylvanians vaccinated when hopefully vaccines are approved to a lower age level, but then also if there's a booster campaign to roll out. We're closely monitoring what the federal government has set for us by way of expectations of the state's role in any booster campaign. Clearly, we're in a different position than the spring, that there seems to be a much more adequate supply of vaccine right now than there was in those early months of the vaccine rollout, which we think will actually allow us to be more smoothly administering a booster campaign in Pennsylvania. But really, our work to date has been focused on prudently preparing for come what may and standing at the ready to make sure Pennsylvanians can receive that booster shot when appropriate.
Our next question is from Brittany Sweeney from WLVT.
Good afternoon. Thanks for taking our questions. I have a question about some major events that are coming up in the Lehigh Valley, such as Music Fest, which is a huge event in the Lehigh Valley. There wasn't really a mask mandate going on there. It was just suggested that if you were unvaccinated, you should wear a mask. Will that change? Do you think all people attending events like that and the Allentown Fair should wear masks, even if they're vaccinated?
Sure. So one of the aspects that we've shifted from, and we've spoken quite candidly about, is there's a lot of self-responsibility. When we lifted the mask mandate and when the mitigation efforts went away, we knew that Pennsylvanians were going to have to make decisions for themselves on what they feel is safe for them, their family, their community. And so, of course, to the extent that there are a multitude of individuals gathering, the mask is going to be a layer of protection, as is the vaccination and all of the other social distancing and other tools that we've been deploying throughout this response. And so at this stage, we think that we see it as not only something that individuals should consider an option or a tool to keep them and their families safe, but something that we can encourage as individuals do try and resume some semblance of normalcy.
Our next question is from Tyler Pratt from WLVR.
Good afternoon. Thank you for taking my question. I wanted just to quickly ask about looking at the vaccination rates in Pennsylvania and what you think the best level of looking at who's vaccinated. So y'all say that 62% is 18 and older. Then we have about 60%, 12 and older. If you look at all of Pennsylvania, that ends up being around 52%. So what is the best level of looking at this?
Sure. So I guess my answer would be all of those. We look closely at every single one of those numbers because that helps us form our strategies in understanding where there might be a population that we need to target through a lot of the hesitancy, the vaccine hesitancy work that Dr. Johnson has been doing and the like. Also, as we have younger and younger individuals be approved to be vaccinated, we're closely watching them. But we closely monitor all of those different cuts of data to make sure that our senior population is as protected as it can be. Understanding the 18 and older population was incredibly important, I think, for us to make sure that prior to any adolescent vaccination, we knew of those that were able to access the vaccine, who really was availing themselves of the vaccine. And now as we have incremental approvals for younger and younger, we're closely monitoring to make sure that the adolescents are availing themselves of the vaccine as well.
Our next question is from Jackie Ferris from WFMZ.
Thanks for taking our calls and our questions. I wanted to ask about things that we're hearing from our viewers about why they're not getting vaccinated. What would you say to people who believe that their chances of getting really sick from catching COVID is so low, they're not going to end up in the hospital, it's going to be mild, that it's less of a risk than getting the vaccine, that a lot of them, they don't believe in the science, and people who believe that when you add those who have had COVID and who have antibodies from being sick in with those who have the vaccine, in their mind, they say, we've already reached herd immunity. What would you say to those folks who believe those various things?
Sure, thank you. And Dr. Johnson is so well versed in being able to reach those that really at this stage are still needing further education and understanding how to change their minds on getting vaccinated. Dr. Johnson?
Great, thank you. I guess let me first address those who have recovered from COVID. So we know what kind of immune response is elicited by the vaccine, so we know that there's a good response. But we also know that people who have recovered from COVID have a wide variety of responses. Some people continue to have an immune response and some people don't. And we don't have a really good way of knowing that. So people who have recovered from the natural disease, we're not sure what their immune status is. The other thing is that in terms of the effectiveness of the vaccine, we know through real-life examples that in populations that have been highly vaccinated, those cases are going down. In the senior population is a good case in point that the hospitalizations and illnesses that we're seeing now are in younger people. Yes, some people recover from COVID, the natural disease, without having serious illness, but some people don't, and we don't have a good way to predict that. So the chances of having a severe reaction or a significant reaction from the vaccine is infinitely smaller than your chance of being hospitalized or having severe illness with COVID. So again, if people have questions about that or need to work that out some more, speak with your healthcare provider, because again, they have, many of them have seen what the cases look like with COVID, the patients who have been hospitalized. And we have seen very many young people who believe themselves to be at low risk have severe problems with COVID. So the vaccines are safe and effective and a great way to keep you from getting the natural disease.
Our next question comes from Trish Hartman from 6ABC.
Hi, Secretary. Secretary. Thank you. My question is also about schools. You said earlier that the state strongly urges schools to abide by the CDC guidance that everyone should wear a mask in school. Here in the Philadelphia area, we're seeing some districts come out with their health and safety plans for the fall, and they have said that masking will be optional. And this has been a challenge for some communities to navigate. Many parents are concerned because children under 12 cannot be vaccinated, and there are other parents who do not want their kids to wear a mask in school. How can you address this?
Oh, sure. So this is clearly an issue that we dealt with during the 2020 and 2021 school year. And the Department of Education and the Department of Health are welcoming of the CDC's guidance, because what we wanted to make sure we had was really that federal perspective being able to be adopted by Pennsylvania School District. And so again, as we work through preparations for what the 2021-2022 school year looks like, we all are trying to make sure that our students get as much time safely in school as possible. And clearly a way of doing that is adopting the CDC's guidance on masking.
Our next question is from Megan Guza from the Tribune Review.
Hi, Secretary. Thanks so much. Not to be over dramatic, but if we stay where we are right now with 50 and some odd % of Pennsylvanians fully vaccinated, what type of spread and kind of dire consequences could we be facing come fall and winter if this more contagious variant starts to surge the way the virus did last fall and winter?
Sure. So first, I don't think you're being overly dramatic at all. That is exactly what the department sees as its duty to prepare for coming into this fall. We want to make sure that we have played out all scenarios. And so we're actively thinking through what preparations for the fall need to be in that worst case scenario position. And first, let's get to your first assumption in that we're not able to move the needle further on vaccinations. And again, just taking this opportunity to really encourage folks to go get vaccinated. That is our number one way of allowing us to have a fall that does not feel like any of the last year that we have had to deal with that's been so tumultuous for any of us. But nonetheless, we are preparing prudently to think through exactly the same vulnerable populations that we had to prioritize with our COVID-19 response previously. And so making sure our long-term care facilities, again, are as safe and as staffed as possible, that our hospitals are not overrun, that folks can access care, no matter if it's because of COVID or if it's because of another incident happening, that we're getting students back into school to the extent that they can do that safely, and making sure that we're keeping students and teachers safe. All of that is scenario planning that we're currently undergoing, and it all leads back to getting as many folks vaccinated as possible. And so if we can move the needle there, that of course tampers down case counts, hospitalizations, and prevents deaths. At this stage, these deaths are preventable. And so we want to make sure that folks do all that they can to talk to their family, their friends, their congregations, their communities about the importance of getting vaccinated and how that will get us out of this pandemic.
Our next question is from Kim Strong from the York Daily Record.
Hi, good afternoon. My question was, really with the percentage of people who are vaccinated, it's close to 60% now. Is that correct?
For 18 and older, for fully vaccinated.
18 and older.
Yep, 60.1.
And what's the number for children?
Sure. So we have, I'm sorry, it's 62.6. I apologize. So for the entire population of Pennsylvania fully vaccinated, it's 52%. For 12 and older, it's 60.1. For 18 and older, it's 62.6. And 65 and older, it's 83.5. And so the children at this stage of the game, we are seeing adolescents get vaccinated, which is exciting given the approval down to age 12. But we, of course, want more parents to be taking the children to their pediatrician, to their primary care physician, or to any of their local drugstores and the like to get vaccinated in preparation for this school year as well.
And our final question comes from Mark Levy of the Associated Press.
I'm good, thanks. I don't have a question.
All right. Well, thank you very much. Thank you, members of the media, for your participation. This press conference,
and
by the
that's
way, was
Acting
recorded
PA Health Secretary Alison Beam. Acting Secretary, you've been listening to her give an update on COVID-19 here in the Commonwealth. Acting Secretary Beam talked about the increase in COVID-19 cases across the Commonwealth. Here's a look at the latest data. You can see that more than 1,000 new cases are reported today. Counties in the darker shade of blue have a higher number of cases. You can see in South Central Pennsylvania, Lancaster and York counties are the darkest. Vaccines were also a big talker during the Department of Health press conference. More than 53,000 vaccines were administered as of midnight. More than 13 million doses have been administered in total. Acting Secretary Beam also said today that text message reminders will be sent to people, encouraging them to get their second shot. Speaking about the CDC's changed mask guidance, Beam asked people to wear masks if they are in communities at an increased level of COVID-19 spread. She called masks a tool to prevent COVID-19 from spreading. Acting Physician General Denise Johnson says women should speak to their OBGYN about questions surrounding the COVID-19 vaccine and infertility. Later this afternoon on Fox 43 News, first at 4 and 5, you can expect more on COVID-19. Our Verified team spoke one-on-one with Dr. Anthony Fauci, why he says the CDC changed its mask guidance. And Fox 43 is keeping you weather smart. Chief Meteorologist Braden Long is tracking showers and storms moving across South Central PA. What are you seeing right now, Braden?
Well, right now, widespread showers across South Central Pennsylvania, as you mentioned, Rachel. Ahead of the main line, we just have some lingering showers from York up to Harrisburg. Stronger ones, though, out towards the west, also just south of Franklin County. Severe thunderstorm warning is in effect for Center County. It's right along the border of Mifflin. That will move into your area over the next 20 to 30 minutes or so. News here, though, brand new tornado watch during while Secretary Beam was speaking was issued until 9 o'clock tonight for everybody across South Central Pennsylvania, as we do continue to monitor our severe weather situation later on for this evening. We've already actually seen a couple tornado warnings out towards our west. Meteorologist Danielle Miller and I will be tracking that as we go into the rest of the evening. She'll have the latest for you coming up on Fox 43 News first at 4. Rachel.
Thank you, Braden. You can always find the most updated weather reports and COVID-19 information on our website and the Fox 43 app. Getting the app is easy. Just text the word app to 717-843-0043 and we'll send you a link back to download it. I'm Rachel Yankunis. We'll see you this afternoon for Fox 43 News first at 4. We now return you to your schedule.